We do feel like we are spending so much time talking about AI. It's just coming into every aspect of our world. Tell us, though, about the study that you guys do. It is your 11th annual. What it's all about, who you talk to, and what are some of the findings?
Well, thank you for having me, Carol. I want to set the table here very quickly because what I talk to healthcare CEOs on a weekly basis, and the same three things always are putting pressure on that system, as you said. They're delivering more care longer to people that are living longer, and that complexity of that care is increasing. So that's actually putting stress on the system. They have staff shortages, which continue to persist and got worse post-pandemic. And then the cost of delivering that care is actually continuing to go up. So all those three things are really putting stress on the system. But the opportunity that we see is AI in healthcare is becoming quite of age, where a year ago in this study, roughly 20,000 people, 2,000 clinicians, 18,000 patients. And what we saw from year to year is they've gone from experimenting and piloting in AI applications to much more broad adoption and impact. Impact in time back they can spend with patients, impact in quality diagnosis, and impact in well-being. And they've been very clear about that in the study.
What do those AI applications in healthcare actually look like in practice?
So I'll give you a simple example that everybody can relate to. So the average physician in this study said that they're getting 5 more patients per week because of tools that they're deploying in their practice. So when I go to my general practitioner, I get maybe 10 or 15 minutes if I'm lucky with him and most of that time it's sitting on the keyboard asking me questions, right? What we're seeing is they're getting the chance to ambient speak what they're talking, that dialogue. It's translating it into the medical record. So what they're doing is they're spending time looking you in the eye, asking you more questions. That's better for more patients they can see because they're spending quality time in the room, or maybe even more patients like we're seeing. Do
doctors feel, or medical professionals, Jeff, feel that we are just barely scratching the surface when it comes to AI in healthcare?
Yeah, a prudent approach is good because you want to make sure that you have responsible AI deployment, and we're hugely, as a tech company, we want to make sure it's responsible. But I actually think we're the scraps at the table and the feast is yet to come.
What do you think that feast looks like?
So take the life of a radiologist. So the average radiologist has to work all day, sees patients, maybe do procedures. Then they take all these studies, 200 studies home at night, and they have to go through these studies. That's pajama time, right? That's long days for radiologists.
Which makes me always nervous as a radiologist who might be tired.
Exactly.
And reading my,
Exactly. So you have these long days, they're stressful.
And I know there's great doctors out there, so I don't want to diss this.
No, but the system is not meant for them to have balance. And so what we're seeing is AI in the pathway. The whole, if you don't think of AI as a bunch of point solutions that do discrete things, in healthcare, it has to fit to the radiologist. It has to fit into their workflow. So I can scan somebody with great AI much faster. I get it into their workflow. I can determine who the most important person is to look at. I can find the slices in their scan that are the most important things to look at and even recommend, we think it looks like this, you should look right here. If you can do that at scale for 200 studies a day, you're dramatically improving quality of life. That radiologist in the study, a third of them say they take a lot less work home and they're suffering less burnout and they're just charged in their balance. That also adds to quality, exactly like you're saying.
I also feel like the data that is input, right? Like there's just more data sets that scans can be compared against, whether it's an MRI, right? Like, do you know what I'm saying? That
we have way more data than anybody can use, but AI can use it.
Right.
And I'll give you an example.
But I mean, when they're comparing scans, right?
Yeah.
It's something that might be overlooked. Again, not dissing anybody professionally, but when you've got just hard, cold data, that's what they're looking at.
In the study, it'll say roughly half of the physicians that use AI as a buddy or as a check are actually more confident in the ability to make their own diagnosis because of the buddy check. And a quarter of them are saying that it's a significant improvement in the result that they deliver. They're not missing medical issues, they're not misidentifying, and they're not missing things. And that's from the physicians themselves that are saying it's actually helping them have higher quality diagnostic, which if you're dealing with something like cancer potential, this is a big deal.
How do you kind of, I guess, help the physicians who maybe see, an introduction of a new technology as just another thing that they have to deal with on top of their already busy day? Like, do you get pushback from maybe, I'm trying to think of some of those old school doctors who still, do everything by hand. They still have paper notes. They still have all their files, in a paper form. This is a pretty advanced technology to have to implement.
I go back to this triple threat, the fact that there are not enough people to do the work today, and they're burning out the ones that are doing it. And so we actually find in most of the larger health systems, there's a huge appetite to embrace this if we're doing the design along the clinical workflow. The challenge is in the industry typically have thrown technology at people and said digest it, and the workflow has to change. We're not doing that at Phillips. We walk alongside our customers. I work with most of all the largest health systems in the U.S. and Canada, and we're walking alongside them. So when we're designing it, we're having them in mind. The beauty of AI-driven tooling is that it can actually do the work if in the process that they're in. We can adapt to do the work. That's a lot different than deploying software and complex things that you have to learn screens and all that. All that goes away. And that's really the promise. What not this magic black box thing. That's actually happening today in some of the leading health systems.
So where do you see it all going? Like, what do you, in terms of generative AI, and what role do you see in, like, I don't know, in the next 3 to 5 years? Like, do you have a feel of how dramatic the impact is?
Well, I think...
Or what are you hearing from the doctors that you talk to?
I think it's a journey that will be rightly done with some conservatism. Again, the operational aspects of clinical practice will have dramatic improvement. That's going to give staff back time to be with patients, and you're going to get a better workforce, and you may even draw people into the practice because they actually have these tools that help them be better at what they do, and they continue to have better balance. The sky's the limit, but we want to make sure when it comes to generative AI that we're really thoughtful about not getting over our skis and allowing hallucinations, because trust is the number one thing. If we build trust with clinicians and we do it in the right way, that embrace and that self-check process actually improves the quality of the output. I met with a bunch of CEOs here in New York last night. Really, really top-notch institutions, and they're actually telling us in 6 months the quality of the generative AI algorithms that they're building is improving itself at a rate they didn't anticipate. So again, I think do it where there's high trust, build that trust with clinicians, design it around the workflow, and then you'll really get better adoption. And we're seeing that. We're seeing year to year, we're seeing a massive improvement in adoption of tooling that is giving life back to a community that joined the practice to serve other people.
Right.
So it's an exciting time.
Okay, so in maybe 3 to 5 years, is the artificial intelligence actually going to be making clinical decisions, i.e. you can go as a patient into a doctor's office, and instead of actually seeing the doctor, there's not a human involved. Essentially, the AI is giving you the diagnosis and telling you.
I think it would be foolhardy to think about what could be in 3 to 5 years because the rate of innovation is so fast. What I can tell you is we believe, as a technology company, that decisions always land with the physicians. And so we want to augment that physician with as much of the non-value add work and as much of the diagnostic quality they can so that they can make the best decision clinically for their patients. And I can't see how that'll change in the near future.
Jeff, what does it mean for the devices that you guys, whether it's MRIs or CAT scans or sonogram, like the devices, the medical equipment, how does it impact you guys as a company and how you have to think about incorporating AI, or is it kind of pretty easy?
It's interesting. We've made the step to become more of a productivity company than a product company. I mean, it's a pretty big leap in this business. We think the beauty of orchestrating a workflow for healthcare concerns is where we want to be. It's not about the products anymore. And so when we think of like our patient monitoring journey, we're thinking about how do I have a persistent monitoring experience across every aspect of where a patient could be in a healthcare system, even at home. And so we're building these platforms around radiology, around cardiology and cardiovascular intervention, and around patient monitoring from home to hospital to home, where we give hospitals that rich data and that physiological data from patients. And we think of it as the software layer or the platform that you can start to build these AI algorithms
kind
into
like
for
cars,
specific.
right?
Exactly right. Think about the apps on your iPhone. Oversimplified, but think about apps on your iPhone, right? You plug the apps in that do certain things, but the platform itself. And that's where we've really moved our R&D.
Hey, listen, we'd be remiss. We've only got about a minute and a half left here, but I got to ask you about the macro. You see a lot. Your company obviously is global. You're in charge of the North American unit. How would you describe the business environment and the consumer side of things?
Actually pretty strong for both, at least for Phillips. In the consumer segments we're in, we're seeing double-digit growth across the globe, particularly strong here in North America. Consumer demand has actually gone up for us, and we've got a great portfolio in the health system side, again, we've seen double-digit growth last year. I think we've consistently outpaced the industry for some time. But about the industry itself, we see strong demand because of all the things we've been talking about. We're pivoting to be less about the product and more about productivity, and I think that's going to be a game changer for health systems. That's long-term demand.
How are you guys using AI at your company?
So we're deploying it everything from our financial systems to my commercial operations to contract management, our services portfolio, so that we can deploy agents to look at systems, health systems, products that we have in the field to be able to do automatic determination of like a root cause and a correction path. We're as committed internally to driving productivity and efficiency so that we can grow with our customers at pace.
Yeah,
So,
it's kind of fast.
We're all in.
You gotta practice what you preach.
I know.
We're all in. We got to eat our own dog food. That's right.
It's exactly.